Hey Dr. Jones, it's Anna. I know I had mentioned previously that I was also going to include the intraoral assessment in this video, but it ended up being too damn long. So this is my take on the extraoral assessment for oral screening. Enjoy. Okay, so we're going to be starting with an extraoral assessment. And to begin, we'll go ahead and do a visual examination. So what this will consist of, here's our patient, Mrs. Schoolcraft, that's what we'll call her. So with the visual examination, we're going to go ahead and just do a general visual examination of the patient's head, neck. We'll also do the backside as well. If you don't mind, Miss Schoolcraft, go ahead and lean forward for me so I can go ahead and take a look at your neck from the back. Alright, go ahead and lean back on the chair. And we're also looking at the patient's face and as well as skin. We're assessing for any variations in skin color, contour consistency, and as well as function. If everything checks out, we'll go ahead and note that in the assessment. But of course, if we see anything that might be a cause of concern for us, such as any spots or lesions, we would want to go ahead and definitely note that in the assessment. And if possible, take a measurement with a probe, so that way, if we measure it, we have a baseline, and when the patient comes back for their next visit, we can go ahead and measure that spot as again, so that way we can compare. All right. So the next thing we'll do, we'll go ahead and do the occipital node. So Mrs. Schoolcraft, I'll go ahead and, if you don't mind, lean your head forward. We're going to turn her this way. So the occipital nodes are located here behind the head, just a little bit underneath the occipital protuberance. So we'll go ahead and use our thumbs for this one. And not just in this case, but in all of the areas that we're going to be palpating, we want to make sure that we compare both the left and right sides. Okay, so we'll go ahead and face this way again. Okay, so what we'll palpate next is the submental and as well as submandibular nodes. So, would it be okay if I touch you in this area? Alrighty, Miss Schoolcraft. So we're going to go ahead and palpate this area. We want to make sure that we press our fingers firmly against the bony structures. So far, so good. We're not really detecting any swollen lymph nodes or anything like that. And if we do come across any enlarged or swollen lymph nodes, we want to make certain or make a note on the assessment. Are the lymph nodes soft, hard, movable, fixed, painful, or painless? And aside from lymph nodes, we're also wanting to detect any nodules or masses. Okay, then we'll go ahead and do a general palpation of the head and the neck. Open up your mouth for me. Close. And then we'll go ahead and continue on with the sublingual and as well as submandibular glands. So Ms. Schoolcraft, if you don't mind, go ahead and put your tongue to the roof of your mouth, so that way we can feel down here for the glands. All right. And then we'll go ahead and move up to the face here. So, Ms. Schoolcraft, go ahead and clench your jaw for me. Here, we're palpating for the parotid glands. So far, so good. And since we're already in this area, we'll go ahead and assess the patient's TMJ. So on here, go ahead and relax your jaw. If you don't mind, Ms. Schoolcraft, just open and close your mouth for me a few times in the most natural way that you can. Okay, go ahead. A little bit slower. So what we're looking for here is any deviation in the patient's jaw, and as well as listening for any popping or clicking, and as well as asking the patient for any pain or discomfort during the facilitation of their jaw movement. Do you feel any discomfort or pain when you open it? Okay, all right. Now again, since we're in this area, we'll go ahead and start palpating the pre-auricular and as well as post-auricular nodes. So we'll start here first. We'll do it individually on one side. We'll start with the right side. Miss Schoolcraft, go ahead and turn just a little bit here for me. Then we'll go ahead and start feeling for the post-auricular nodes. Okay, all right, Miss Schoolcraft, go ahead and turn this way for me. We'll go ahead and do the left pre-auricular nodes in this area. And we'll go ahead and do the post-auricular nodes here. All right. So what we will do next, we're going to go ahead and palpate the cervical chain. So we're going to do the same thing. Miss Schoolcraft, go ahead and look to the left for me. And if you don't mind, I'll go ahead and put my hand here just a little bit under your chin, and we'll go ahead and tuck down. So that way, this makes the SCM, the sternocleidomastoid muscle, a little bit more palpable, which is right here. Now we do want to make note that not all patients will be comfortable being palpated in this area, especially in the case of assault victims. So we want to make sure that at the beginning, or even before we do the assessment, we explain to the patients that this assessment, since it has a very physical aspect, we want to make sure we tell them what it'll entail and what to expect. We want to gauge their comfort level and ultimately get their permission to do this. But again, just some things to consider, again, because not every patient will be comfortable being touched in this area, or let alone palpated. So we'll go ahead and do the anterior cervical chain. It's a little bit deep to the SCM muscle. And then we'll do the posterior cervical chain. And since we are in this area, this is also the perfect time to palpate the supraclavicular nodes, which is going to be right here where her clavicles will be, right here. I actually do feel them, but they feel pretty normal. Alrighty, Miss Schoolcraft, we'll go ahead and turn this way, chin down. So same thing here. We'll go ahead and look for the SCM muscle. It might be a little bit tricky to find. There it is, thank you. It's ticklish. We're almost done, I promise. All right, then we'll move on to the anterior cervical chain. We're almost done with the extraoral assessment, I promise. It's also good to remind patients and reassure them that, you know, we're coming close to the end of the assessment, instead, you know, in case they get a little bit uncomfortable or they get a little bit ticklish in the case of Miss Schoolcraft. Then we'll do posterior. And then again, supraclavicular nodes. Now her nodes might be a little bit swollen here, but that's because Miss Schoolcraft here recently got her flu shot and as well as her booster for her COVID. So it might be a little bit swollen in this area, but nothing to be concerned about. Alright, so Miss Schoolcraft, look ahead. What we're going to do next is we're going to palpate the thyroid. We're going to do it from behind. So, go ahead and lean the back just a little bit. Where is this? Perfect. Okay. So as we're palpating the thyroid, just know that as we gently press our fingers against it, we're going to slightly displace the trachea. Right there. Alright, and then the last extraoral exam that we're going to perform is for the larynx. We're going to go ahead and do it from the front. Alright, Miss Schoolcraft, if you don't mind, go ahead and swallow for me. Do it one more time. Okay, it might be easier if we actually had her swallow something. Alright. It's probably good if we actually have any difficulty swallowing. Okay. It's probably best if we already have like a little drink ready beforehand to do this part. But everything checks out, and so that concludes the extraoral assessments for this part. Alright, hey Dr. Jones, you made it to the end of the video. Good job. This is just me critiquing myself, but I went ahead and noted that I said go ahead in this video 34 times. Sorry about that. But anyhow, that's it.